Hi, everyone, and welcome back to another episode of What Happens in Vegas. Today, I'm going to be doing a solo. I'm Dr. Stephanie Canistro, your host, and I really dive into, if this is your first time listening, everything I've learned through my pretty severe health struggles of having chronic Lyme or chronic complex illness and trying to really break it down for everyone and show, kind of how I got here, what were the things leading up, what have I learned, what works, what doesn't work, and not just based on my own story, but based on what I've seen with other patients. I was just in Dominican for 2 months. I am at the point, the cusp of, just having kind of these lingering symptoms that won't clear, or having like lots of good days and then some bad days. And I'm trying to get to robust health, which is what I think everyone deserves. And I kind of reached another moment or another breakthrough in my healing journey. So I kind of want to touch on that a bit and then see what else comes up as I'm explaining to you what comes up, different things that I've experienced. Those of you that don't know my story, I grew up, I had, symptoms. I had eczema here and there. I had lots of gastrointestinal symptoms that were brushed aside, and it's irritable bowel and you have to deal with it. I had lots of cramps and put on the pill, and I had even problems as a baby, really overreacting to I couldn't wear plastic diapers. They had me in cloth diapers in the 80s. I was drinking out of a glass bottle because I was allergic to the plastic. So that kind of set the stage for, this is a reactive baby, high toxic load, things that they don't tell you. And they don't tell mothers to even detox before having a baby. Like 3 months before is about the time that you should do a really big cleanup of things that bog down our health, of things that get stuck in our bodies, things like heavy metals, checking for mold and mycotoxins, different parasites, environmental toxins, which are through the roof these days. And helping that, because our biggest detox as a female, and one of the reasons that women who have babies have less health problems in general, it's not a complete rule, is because they do detox onto these babies. So in the umbilical cord, they've found heavy metals, forever chemicals, all of these things. So our babies are not born pure, they're actually born toxic. And, there's ways that you can detox before. And then if you haven't detoxed, ways that you can help just modulate the baby's um, immune system in a positive way, always keeping the gut in mind, what the mother intakes. So that's a whole other thing. But, just to show that, I was already kind of hyper reactive, maybe didn't have the best detox. And those are all things that I learned that were true as my story unfolded. In, what we see with people and what we saw with myself is that you get through life, you have some ups and downs. You're generally healthy because you're young and you have something called organ reserve. Your cells are you're still anabolic, right? You're still growing. So there's a certain protection. And then people hit about, somewhere for girls in their early 20s and guys, maybe late 20s, early 30s, where, you start to go into the breakdown stage and some of these things start to show you more symptoms that you maybe had kind of nudging you in the past. And they really kind of come to a halt for your health. So that's what we see with people. And, it's pretty sad because I think, I probably had a parasite infection maybe my whole life. But I remember when I was about 6 years old having like excruciating stomach pain after eating like a cheesy, greasy pizza, and probably needed some liver support. But, your parents don't know any better and you go to the doctor and you're told you're fine. And, so these are things that we want to try and catch early, and we're just trying to shed some light on it, because then the next time my health came crashing down, it's always when there's like a perfect storm, when autoimmunity turns on, when cancer can take over, when bugs that were in our body but not creating a whole symptom pattern are there festering, but then there's an event or a trauma that brings out these problems because your body loses homeostasis, like that control that it has. So for me, that happened at my last year of chiropractic college. Obviously a very stressful time. You're doing boards. My grandfather got really sick and I was the one introducing him to the people, or he was getting a major surgery that I really didn't agree with getting, but he had major complications and he almost passed away, and I was taking this all on, and things just went from bad to worse, where all of a sudden severe neurological symptoms turned on. And I remember I was in a movie theater, and I'm going to kind of come back to why that is an important point, because it turns out I was really electrosensitive because I had really high heavy metals that were never diagnosed. And at that time, I had severe muscle twitches, tingling all over my body, sense of impending doom, so much fear, so much anxiety, inability to sleep, joint pain that shifted from joint to joint, this like feeling of swelling without seeing any swelling. I mean, I felt insane, got severely dizzy after being adjusted because my nervous system couldn't handle it. But at that time, they send you to the hospital thinking it's some sort of stroke or something. So then I was injected with gadolinium, and that's a toxin. And, things went from kind of bad to worse, to where I woke up and I was only taken seriously after um, half of my face was Bell's palsy. And luckily mine was really transient. And then they started investigating me for multiple sclerosis, or these, neurological degenerative diseases that they tell you are autoimmune, and they say there's no kind of cure for, and then you just have to, shut down your immune system. And, the diagnosis I got was, okay, you have some lesions. They're small and there's not 5. And if there's not 5, we can't call it multiple sclerosis. So we just watch and we wait. And I thought, that's not me. I'm not going to watch and wait. There's got to be a reason. I felt normal a few weeks ago, and now my whole world is spiraling. And then with those symptoms, I noted, if you were to actually look it up and people could plug it into ChatGPT, it might tell you I had acute Lyme borreliosis. And Lyme could have been in my body since I was born. It can be passed on that way. People think that you have to be bit by a tick to have Lyme, but you can be any stinging vector that happens to be carrying it. Spider bites have been shown. I got bit by bed bugs around that time, which is gross. And, Lyme is a funny thing because a lot of people can have it and have antibodies to it and fight it off, and, because their immune system was normal, and then it either goes into a hibernative stage. I do think that people can clear Lyme completely. You can clear the persister cells, and there's lots of studies even on stevia. You use it in a higher dose to kill the persister cells. There's a lot of new treatments coming out for Lyme, but what I found through my own struggles, and, I fully healed for 10 years after that flare, because I started looking into functional medicine. That's how I got into functional medicine. I found Dr. Terry Walls. I did this huge diet change. I found someone who told me to cleanse parasites, and that was enough for me, for my body to take hold, my immune system, because your immune system is what goes off and isn't clearing the infections anymore, or you're hyperreacting and creating way more waste than your body can keep up with. And I've seen this in my own live blood cell, and I've had, the person who did my live blood cell, who really helped me to see clearly what my infections were, and that it was like a toxic soup. In 2021, when all of my symptoms reemerged, the first time was in 2010 with the textbook Lyme borreliosis. And so what I find is that it's not just Lyme, you know, that cause these chronic complex symptoms. And there's different triggers. So my trigger in 2021 was COVID vaccine shedding, and um, mold and 5G that kind of bogged my body down so much that it couldn't keep up anymore. And I'll go into how those things happen. But, mold really inhibits the immune system, and so does Lyme. So when one already has Lyme inside their body, and then they get exposed to a big mold exposure or a big trauma or whatever, like the problem was at that point in time, then you can get all of that turned on, because they're opportunistic and they see your body's struggling. So it's safe for me to replicate. And then once they start replicating, well, the faster you catch them, the less chance of it becoming chronic. But because it's so poorly understood, no one gets tested for it, or they get a false negative because of the way that the testing for Lyme is created. And that's an interesting story, because one of the most important diagnostic titers for Lyme were taken out of the diagnostic criteria when they tried to create a vaccine for it. The vaccine injured too many people, so it was pulled from the market. However, they never reinstated those titers that would be created by the vaccine, because they didn't want to get false positives for people that had the vaccine. So really, our testing is poor, misses it. Lyme doesn't stay within circulation. Lyme is a spiral-shaped bacteria. It burrows, right? So they have to only test for different proteins that fall off of it, or it's rare that you see the whole bug, although in my live blood cell you could see the spirochete. One of them was right inside the blood cell. But going back to my live blood cell, what we saw was I had mold floating around. I had Lyme. I had Babesia. I had Bartonella. I had E. coli floating around, right? I was in so much pain. I had these crazy symptoms in my kidneys. My liver was aching because I was a toxic soup. And then in the live blood cell, you can see your white blood cells. And those are the things that have to go in and clean up everything. And within my white blood cells, they were just sitting there. They were like, I give up. There's too much. So they were completely sluggish. They probably were overstimulated and overactive for so long. And now they're just sitting there. So everything's just building and building, and my body was healthy. So I'm not getting sepsis or anything like that. But I'm struggling. I'm in excruciating pain. I can't sleep at night. My lymph is swollen. I'm not draining. I literally would not wish how I felt on my worst enemy. And, I felt like I even wrote a poem because I do that sometimes when I'm suffering. And it was like, I feel like the devil is inside of my body. I couldn't stop crying, was really emotional. I mean, the kidney pain was just insane. The liver pain, the muscle twitches, the feeling like I want to jump out of my skin, like quite literally the most severe anxiety that you ever said, like the sense of impending doom, the heart palps, oh my gosh, I just can't even remember every symptom right now. But, it kind of made sense when you saw that toxic soup, and you got to start to turn on the immune system slowly and get the bugs out. And that's why binders are so important to me, because I saw that waste in my body floating around and I knew my body couldn't keep up. And when I would take a binder, I would get a few minutes of relief. And so I utilized binders in a much higher dose than maybe most people would. And, I learned a lot along the way about immune modulation. I mean, I wish I knew at that point about ionospheresis, which I still plan on doing, but that's when they filter your blood, almost like a dialysis type of thing. So, and they take out the kind of dirty plasma and they replace it, but they also filter out with a really fine filter and get out a lot of metals. And I've seen some crazy changes from people doing that. And again, that's just getting the top layer, because think about it, that's what's floating in the bloodstream and the plasma. But these problems go deeper into your fascia, right? They go, into your actual organs. But when you can clean out that first layer, there's also EBU machines, which again, they take the blood, they ozonate it. Ozone kills a lot, and also, can help get rid of environmental toxins. It hyperoxygenates the blood, because even when you're sick like that, you see your blood, you're not getting enough oxygen anywhere. Your blood's become thicker, right? Nothing's flowing. And we talk about fluid dynamics a lot because, again, manual treatment helped me so much. And what I figured out was, as I worked on my fascia and all of the tissue, I was helping move this really kind of stuck lymph. My lymphatic problems were very clear. I was swollen in my chest on the left-hand side, which is where 75% of your lymph clears. And I talk about that a lot, and we're talking about that in our course coming up. But and then it takes years, once this kind of problem has turned on and you're this toxic, to like get back to stable. So that's what we help people do. And all along the way, I was improving. It's not just a straight line of healing, but it's kind of this zigzag up where, certain things flare you. So, I was doing a lot better. And I realized I did a lot better when I was in climates where it was humid and in places where there was less electromagnetic frequencies. So for the last 2 months, I was in Dominican, and, the moment I got there, I felt rejuvenated. I had these rashes on my arms that no matter what I did would not clear in the winter, and they disappeared. That humidity gives that barrier protection. So, and, that brings me to wanting to talk about mast cell activation and POTS and, Ehlers-Danlos and all of these things that people are talking about. So I'll touch on those quickly because they go along with what I was talking about with this toxic soup that I saw in my bloodstream, right? So now what does happen is your immune system is trying to work hard to clean it up. Right. And so there was parasites in my blood. Babesia is a parasite. Your body uses eosinophils and basophils to clear and try and kill parasites. Your own body makes histamine, right? Your liver has to clear histamine. but your liver's not, it's sluggish, it's not working really well. So your body's trying to kill something. You're creating this response with histamine, and then you're not able to clear it. And then you're told you have mast cell activation, which you do, but you have to work on getting infections out, binding. There's binders that bind onto histamine. There's histamine modulators. There's histamine enzymes. So you've got to like double up on those things. And when histamine stays up for a long time, you do get breakdown of soft tissue and collagen. And also these infections themselves break it down, your collagen. You get heavy metals in place of where your minerals were. They start to take up those places, and that damages your collagen and your soft tissue. So you end up with weaker collagen, which can lead to Ehlers-Danlos-like symptoms. EDS, if you don't know what that is, that's a collagen disorder, but it's genetic. And most of the people that are having these problems aren't having the genetics of it. And then this can lead to POTS symptoms because your organs shift a tiny bit and your autonomic nervous system is in fight or flight. And you end up with the inability to regulate your blood pressure, So all of these things, when you break it down, it ends up, you have to help the body clean up. You have to support the immune system. You have to support mast cell activation. And you're going to have to play around to see what works for you, what works in your budget. But I'll tell you, if you're having these symptoms, the symptom patterns of chronic pain, chronic anxiety, chronic strange symptoms, rashes showing up, swelling, lymphatic problems, if you're having the heart palps, all of these like chronic complex syndrome that we call it, you end up with, you can end up with multiple diagnoses, but at the end of the day, you have to clean up the body. You have to support getting out what you can get out. You have to have someone who knows how to guide you through it, because there's multiple ups and downs. You're going to think it's not working when it really is just a herx. So now let's go back to Dominican. I get there. I feel a lot better. I still have to work a lot. I don't get to just enjoy my time there. We're having visitors coming through. I don't know how to like completely slow down. And that's probably and it is part of almost everyone who gets these type of symptoms, right? There's like personality traits that go along with them. So I'm feeling like good, so I don't want to push it too much, but there's still some lingering stuff. I talked about my burnt esophagus, which again, Lyme and the whole mast cell activation and the whole weakening of your diaphragm because of your nervous system, the whole weakening of your tissue. I got a hiatal hernia through Lyme. I had the oil of oregano get stuck. I had severe burns of my esophagus, so I was having trouble swallowing. So I'm like, I'm going to fast for these days. I'm going to work on my stomach to push down this hiatal hernia, and I'm going to um, do what I have to do to get better. And so I decided I was going to do a water fast. Well, even a water fast creates autophagy, so you detox, and I got shingles after that. So I worked through the shingles. I got rid of them really fast. They're really painful and really uncomfortable, and show that my body's still got stuff that's from the chickenpox virus, which is a herpes type virus. It's called varicella zoster. So I work through that very quickly. Okay, I'm proud of my body. I get over that. I get something called a margarita burn, which is, just bad luck because the sun was hitting as I was getting treatment on my abdomen, and the sun reacts with anything from the Lyme family, like even dill, if it's on the fingers, even the oil's left on. So they call it a margarita burn because people will spill drinks on their arms. So whatever, that's another thing. But just, we're just trying to go into weird symptoms here. So that's almost like a chemical burn, and you have to completely be out of the sun in that body part. Okay, I found a great osteopath there, helped a lot to like bring the hiatal hernia down. I'm feeling better. And I also found a German doctor there that was doing some crazy therapies for Lyme and infections. And she was well versed in all of it because she went through it herself. But, I'm very sensitive, and her cocktails were a little bit intense. So I asked for like a gentle IV. Like I don't do IVs lately. Like I really reacted to ozone, my veins collapse. Like I had a crazy experience with vitamin C IV. So anyways, I just wanted something really gentle. But what she did was not gentle for my body. And I went into what felt like almost like meningitis symptoms. I thought it was just like a Myers cocktail with some glutathione, but it ended up being much different than that. And I'm thankful now for it. But if we're going to talk about a Herxheimer reaction, if anyone knows what that is, it's when your symptoms get worse when you're actually killing or getting rid of the problem that's causing you these symptoms. So essentially, I'd been having still a lot of cerebral spinal fluid symptoms. So, which can come with Lyme, with something called Bartonella, which is a bacteria. And I had this dent that forms in my head. I was having different, like really big changes in my cerebral spinal fluid. And people might feel that as headaches, but I would feel like pain in my low back on the right side. It would shoot down my leg sometimes. So I had these neurological symptoms still in my spine. And I could feel these changes in pressure that happened because I would get an indent in the top of my head, or then it would pulse out and be this like very like huge amount of pressure. I would almost feel like a cone head, and I'd have to work to clear my lymph from my neck. Anyway, so I go for this IV. I'm under the impression, I'm in Dominican, remember, so it's not, I didn't know exactly what was in it. People probably think I'm crazy. Nonetheless, she ends up doing an IV push. I thought it was going to be in saline, but it wasn't. It was direct in the vein. And, I felt a little funny after, but I'm like, you're okay. You've been through so much. You're strong. I go home. I go to bed. Again, feeling a little funny. I wake up in the middle of the night and I have this surge in my spine. And I'm like, oh my gosh. I felt like my head would explode. I got the highest fever that I've had. And by the way, fevers evaded me for 10 years. I did not get sick for 10 years. I didn't get colds or flus. But colds and flus are when your body creates this response and it creates all this heat and it kills multiple things. Lyme hates hyperthermia. There's hyperthermia treatments. So turning on a fever for me was not a bad thing, but it was scary in the moment because my whole spine felt like it would burst. My head felt like it would burst. I thought I was going to have to go to the hospital. I was trying to take binders. I took extra silver because silver, it just generally kills things in case things got stirred up, and my body couldn't keep up with it. But my fever wasn't breaking. We're going on to day 2 and then to day 3. But then at the end of day 2, I decided to take something called Pectisol. Pectisol's modified citrus pectin. And I know that it can help with the cytokine storm. And when you have a bad fever, there's a lot of cytokines. And so I took 3 capsules of that, and I felt my fever break for the first time. I even ate a popsicle, like that nausea went away. I also was constipated with this whole thing. I didn't go to the washroom for like 3-4 days, which isn't like me. So I was scared, but I knew my body was going through something. I knew I had this IV. I was reaching out like, what's in the IV? And there was gold and there was platinum, and that kills things. There was silver in the IV. There was some NAD in the IV. There was just a whole bunch of minerals and some silica that pulls aluminum. So it was a lot for my body. Once I broke the fever though, and leading up till now, I've had a lot less of these crazy symptoms in my head and my spine. I feel calmer. I feel like I can work manually a little bit and not have my spine feel like it's going to go into spasm. So that's a Herxheimer reaction. It created this huge response. My body killed it. I was sick. I felt like it was a mistake. And then I got through it with the help of my own knowledge and whatever I could take in. I was also taking some glutathione and stuff to help because I know those things help me. And it was hard because I'm still at the point where I can't swallow pills because the burns were so bad in my esophagus, but I think I'm getting there with that. So, I guess what I'm saying is there's sometimes it's these more aggressive things, even though that person thought that was gentle, it was aggressive for me, that can help move the needle in there. I was supposed to go back for things that actually killed, like artemisinin, which is a potent antiparasitic. It's from wormwood or artemisia, which I've taken numerous times orally, but it can kill a ton of things in your bloodstream. So it's still something that I would consider doing. And I know a lot of practitioners in Germany are able to do that. I know it's a lot less easy to find in North America, but definitely there are places that bioregulatory medicine places, people who have studied under Klinghardt that utilize those things. And yeah, I just, learned something else about these minerals. And silica, I had been taking like these micro doses because I do everything slow and conservatively, and then I had it pushed in my veins. So I probably got some of the aluminum out, which aluminum has been high a lot in a lot of people. So we, it was one of those moments that really moved the needle for me. There were other things that I've talked about in the past that really helped me, and that was neural therapy, which is the injection of procaine in different homeopathics. And for me, it was used in different organs skin over top of the organ. They're called bleps, or, they almost look like little bee stings because you're just putting the fluid like right under the skin. Some of them went into ganglias, but they help drain your body. So that was another more less conservative treatment that really helped me. But then the day-to-day stuff where I'm taking the stuff to kill the pathogens, and I'm staying on that course, and I'm also binding, and I'm also getting manual treatment and doing manual treatment on myself. Those are the things that move the needle. And even if you cannot do testing, you can do all of these things. You can even take herbs that just generally kill these things based on your symptom patterns, because testing is, severely expensive. I'm about to retest to see what that really cleared, because there was still, although I had severe titers of Lyme, I had it very in the acute phase and in the chronic phase. When you looked at my immune system at the time that I did the test originally, then I did it again. I had brought all of them down, but I hadn't fully gotten rid of the Lyme, although I got rid of some other co-infections and whatnot. So, I'm excited to see what was cleared there. I still had some toxoplasma, which is the terrible parasite that can go to your brain from, most common place people get it is cat poop. Some people, that's why they tell you not to change the baby's litter, or the cat's litter when you have a baby. But that is what I feel was cleared intuitively. So we'll see, and I'll keep you guys posted on that. But I guess the point of this whole episode was to kind of just open your eyes on different symptom patterns, different reasons why things are the way they are. Find someone who is going to actually dive into like what's going on. It's going to help you quarterback you through what's the best therapies in your area, finding people that can do all of these different therapies. And then you create your own little health haven around you that you can lean on and help to just work through each symptom until it goes away, to try different things if one thing isn't working, and I use these same things when I'm working with elite athletes. We still go in and we make sure that we lower their toxic load so that they're never at the tipping point where I was. And then you're preventing disease, and you're protecting your cells, and you're protecting yourself from these catastrophic things. And, I feel my body in every symptom, and some people don't until they have like worse symptoms. So I think even if you're not having symptoms, starting to do some detoxing, to look into all this, like liver cleansing, like all of these things that, we're living in a toxic world. I didn't really get to touch on all the 5G stuff. I talk about it numerous times, but a reason I think a lot of people are reaching their tipping points these days is because, first of all, there was a novel virus that was very inflammatory that came out at the same time. They released 5G is a man-made frequency that they showed, makes mold 600 pathogenic. So it's giving off 600 times more mold spores. And that's what we breathe in, get exposed to, screws up our immune system. Some people have mold living inside of them. So now you're getting this direct wave coming at you because you're holding onto your phone and it's connected to 5G, and you're getting mold that's living in your body is more pathogenic now. It's giving off more toxins. Then that happens, and say you had Lyme in hibernation and it goes, mold is getting crazy. It's taking the attention of the immune system. I'm going to start replicating. And then you end up with these chronic crazy symptoms. Okay. There's some evidence that like the spike protein can stay in the body, and there's ways to detox that. Heavy metals make you attract more of the direct waves of these electromagnetic frequencies. So we need to get those out. Environmental chemicals, EOCs, off-gassing, all of these different chemicals we're exposed to. If we focus on our microbiome can break down these things, but most people's microbiomes, because we're exposed to things like glyphosate and pesticides, we're not having our good bacteria. They're the ones that are dying, and the bad bacteria, because it doesn't die by that pesticide, which is glyphosate, which is Roundup. And then you're ending up with a more pathogenic bacteria in your gut. And that's what we're seeing with people, right? So we need to re-inoculate the good bugs so we can actually break down all these new chemicals that we're getting exposed to. So, I'm leaving you with that. You can listen to other podcasts. You can listen to me being interviewed on other podcasts where I go into it even more detail. But my whole overreaching thing is there are different things that you don't know about that can work. There's a lot going on, even in the cancer world. There's Immunoscience Center. There's, Hope for Cancer Mexico. There's all of these different things that are looking at, the parasitic nature of when you actually dissect things like multiple sclerosis, or look at the cerebral spinal fluid of multiple sclerosis, or cut into the tumor and see what's actually in there. They're parasite driven, Lyme driven, all of these toxins that I'm telling you about. So we need to clean them out so that we're protecting our own bodies. Like, listen to Dr. Dr. Alan McDonald's work. That's who I listen to for one of my aha moments for all the multiple sclerosis stuff. And that's why I cleansed parasites and essentially shut that down, even though it was Lyme. Lyme's parasitic as well to an extent. And lots of the things I took for that could have killed the Lyme, given my body a chance to kill it. And even that IV that I took, it killed a bunch of them, but and then it boosted my immune system enough that it allowed me to fight off something that was still festering in my body that my immune system couldn't. And then it gives your body a chance to do what it has to do. Because your immune system at the end of the day is what has to clean up this. It's what has to protect you. So I'm trying to nurture it. I try to de-stress. I try to be away from electronics as much as I can. I was lucky enough to be able to go and ground every day in Dominican. And let me tell you, the difference I feel from being there and coming back is the first thing I feel is more electric, more static, shocking stuff. Like I get a tiny bit of the rash coming back on my arms, So this electromagnetic part of it, we can't forget, and we have to do our best to go down, touch the earth, absorb the electrons. Summer's coming, so we have the chance to do that. And just so you know, another thing, if you're in the anti-aging and longevity thing, the fastest thing to age you are these terrible electromagnetic frequencies. They call it early graying of your hair. If you've noticed anything like that, it can cause like stagnant lymph, change your iron, change your calcium, and you start to calcify and get brittle and old. So, just keep that in mind, because usually we're vain people, and that's okay. I mean, the changes I saw from these attacks on my body were not great. It was rapid aging, but I do plan on being able to reverse that and share that with you. Those will be the next steps now that I'm in the more healing phase. Or more less vulnerable stage. So if you're suffering with any chronic symptoms, if any of this resonates, then you can reach out to Vegas Clinic. We will help walk you through your weird symptoms and try to explain them to you, because the more you understand them and can troubleshoot them, the less scary they are. So until next time, more of my story. We got some good guests coming up for you in the next few weeks, and thank you so much for listening.